Hello, my name is Nicole Miller. I'm a student at Indiana State University in Community Public Health Nursing, and today I'll be doing a presentation on fetal alcohol syndrome. There are 6 learning objectives. The first is, what is fetal alcohol syndrome, or FAS? What causes fetal alcohol syndrome? How is fetal alcohol syndrome diagnosed? What are the signs and symptoms of FAS? How is FAS treated, and how can FAS be prevented? If you like, before watching the video, please click on the link under the video titled Pretest. You can test yourself on the subject matter before watching the video. What is fetal alcohol syndrome? During pregnancy, a fetus can acquire fetal alcohol syndrome, also FAS, a disorder that occurs when the mother consumes alcohol. When a sickness or abnormal state causes a set of symptoms to occur simultaneously, it is known as a syndrome. People who are diagnosed with fetal alcohol spectrum disorders have fetal alcohol syndrome as their most severe form of condition. What causes fetal alcohol syndrome? Wine, beer, hard ciders, and hard liquor are all forms of alcohol that can cause fetal alcohol syndrome in pregnant women. FAS does not occur in the absence of alcohol usage. The umbilical cord acts as a conduit for alcohol to enter the fetus system, making it particularly hazardous to consume while pregnant. Alcohol takes longer to leave a baby's system than it does in adults because of the baby's slower metabolism. How does alcohol affect the fetus? Fetal brain and central nervous system development can be disrupted by drinking alcohol during pregnancy. This can take place in a variety of ways. The fetus's physical development can be altered if the fetus's cells are damaged by alcohol. Alcohol interferes with the development of nerve cells, the movement of these cells to different areas of the brain, and the functioning of these cells. Alcohol reduces blood flow to the placenta by constricting the arteries in the body, which is the food supply while in the uterus. This results in the fetus being starved of oxygen and nutrients. When the body breaks down alcohol, toxic byproducts are created. In the baby's brain cells, they can cause harm. FAS diagnoses. Different FASD diagnoses are based on particular symptoms and include fetal alcohol syndrome. FAS is the most severe form of FASD. FAS causes issues with the central nervous system, minor facial traits, and growth. FAS patients may struggle with memory, attention, speech, vision, or hearing. They may have a variety of issues. FAS sufferers typically struggle in school and socially. Alcohol-related neurodevelopmental disorder. ARND causes behavioral and cognitive issues. They may struggle with math, memory, attention, judgment, and poor impulse control. Alcohol-related birth defects. ARBD can cause heart, kidney, bone, or hearing issues. They may have a mix of these. FAS symptoms. Physical defects. Small eyes, thin upper lip, short, tilted nose, and smooth skin surface between the nose and upper lip. Slow development before and after birth. Small head and brain size. Heart abnormalities, kidney and bone issues. Brain and central nervous system problems. disabilities, learning problems, and developmental delays, attention and information processing issues, nervousness or agitation, social and behavioral issues, difficulty in school, behavior and impulse control issues, poor concept of time. Factors that reduce secondary FAS. Early diagnosis. Children identified at an early age can be put in suitable educational courses and get the social supports they and their families require to be helped. When a kid is diagnosed at an early age, parents and teachers can better understand why their child behaves or reacts in certain ways that other children do not. Involvement in education, social services. Kids are more likely to reach their full potential if they get special attention that is based on their needs and the way they learn best. It might be hard for children with FASD to learn and behave the way they should. There are a lot of things that might need to be done. Special programs can better meet the needs of each child. People who get social services, like counseling or time off, have better experiences than people who don't get these things. Loving, stable home environment. Children with FASDs can be more sensitive than other children to disruptions, changes in lifestyle or routines, and harmful relationships. Therefore, having a loving, stable home life is very important for a child with an FASD. In addition, community and family support can help prevent criminal behavior, unemployment, and incomplete education. Prevention. Make sure you don't drink alcohol if you want to have a baby. In the case that you haven't already, don't drink again as soon as you find out about your pregnancy, or even if you think you might be. The sooner you stop drinking during your pregnancy, the better it is for your baby. It's never too late to stop drinking during your pregnancy. Continue to stay away from alcohol while you're pregnant. Fetal alcohol syndrome is completely avoidable in children whose mothers don't drink while they're pregnant, but it can still happen. If you have a problem with alcohol, get help before you get pregnant so that you don't harm your child. Professional help can help you figure out how much alcohol you're addicted to and how to treat it. Thank you for watching this video. If you like, again, please click on the links under the video for the pre-test, the post-test, and a flyer for more information on different websites to learn more about fetal alcohol syndrome. Thank you.